If you're over 60 and you fly even once a year, there's something you need to know. Cabin crew are trained in basic first aid, but they are not doctors, they are not nurses, and their emergency protocols were not designed with your body in mind. The truth is, senior travelers face specific medical risks at 35,000 feet that younger passengers simply don't, and nobody walks you through them before you board. Not the airline, not the gate agent, not the safety card in your seat pocket. In this video, we're breaking down 10 in-flight medical emergencies that affect seniors more than any other group, and more importantly, exactly what you can do to prevent each one. Now, emergency number 7 is the one that stops people in their tracks. It's a type of heart attack that looks nothing like what you've been taught to recognize, and at cruising altitude, even trained crew miss it almost every time. We'll get to that one, but first, tap that like button and hit subscribe so you join thousands of senior travelers who stay one step ahead every time they fly. Let's get into it. Emergency number 1, severe dehydration and fainting. Here's something most people don't realize. The air inside an airplane cabin sits at around 10 to 20% humidity. That's drier than the Sahara Desert. For younger passengers, that's just uncomfortable. For seniors, especially those taking diuretics, blood pressure medications, or anything that reduces fluid retention, it's a setup for dizziness, confusion, and fainting. Your thirst sensation naturally decreases with age, so by the time you feel thirsty, you're already dehydrated. Start hydrating the day before your flight, bring electrolytes, skip the coffee and alcohol, and drink water every 30 minutes in the air. Tell your flight attendant, "I'm prone to dehydration. Can I get water regularly throughout the flight?" They'll remember you. Emergency number 2, ear barotrauma and severe pain. When the plane climbs or descends, the pressure changes rapidly. And for seniors with sinus issues or eustachian tube dysfunction, this can cause extreme ear pain, temporary hearing loss, or even a ruptured eardrum. The fix is simple, but you need to know it in advance. Try the Valsalva maneuver, pinch your nose, and gently blow until your ears pop. Filtered pressure-regulating earplugs can also make a huge difference. And here's one most people miss. A decongestant nasal spray about 30 minutes before descent can prevent the worst of it. Just check with your doctor first. Those first 2 emergencies are about comfort. The next 2 are about survival. Emergency number 3, deep vein thrombosis, also known as blood clots. You've probably heard this one mentioned before, but most seniors dramatically underestimate how dangerous it actually is. When you sit motionless in a cramped economy seat for 4 or more hours, blood flow in your legs slows to a crawl. For seniors, especially those with varicose veins, a history of clotting, or anyone on hormone therapy, the risk climbs significantly. Here's the part that scares doctors. A clot that forms in your leg can break loose and travel to your lungs. That's called a pulmonary embolism. And at 35,000 feet with no hospital in sight, it can be fatal. But this one is almost entirely preventable. Before your flight, pick up a pair of compression socks. 15 to 20 millimeters of mercury is the right grade for most travelers. Book an aisle seat so you can stand up and walk once every hour without climbing over anyone. Do ankle circles every 30 minutes while seated, and talk to your doctor about whether a low-dose aspirin before long flights makes sense for you. When you board, tell the crew, "I have a circulation concern. Is there space to stand or walk periodically?" They'll make sure you're not blocked by the beverage cart when you need to move. Emergency number 4, hypoxia and oxygen desaturation. This is the silent one. Cabin pressure during flight is equivalent to sitting at 6,000 to 8,000 feet of elevation. If you're healthy, your body adjusts without you noticing. But if you have COPD, heart failure, pulmonary fibrosis, or even moderate anemia, that pressure drop can quietly push your blood oxygen to dangerous levels. The symptoms are subtle and easy to dismiss: confusion, dizziness, bluish fingertips, unusual fatigue. You might think it's just jet lag kicking in early. It's not. If you have any lung or heart condition, Ask your doctor about a fitness to fly test before you book your ticket. Some airlines provide supplemental oxygen on board, but they require 48 hours advance notice and a medical form. Ask them directly, I have a respiratory condition. What's the process for arranging supplemental oxygen? And consider packing a portable pulse oximeter. It's a small clip that fits on your fingertip, costs under $20, and it could save your life. Now, this next one affects millions of senior travelers and almost nobody plans for it. Emergency number 5, blood sugar emergencies. If you're diabetic or pre-diabetic, flying throws your body a curveball in ways you might not expect. Think about it. Yeah, you cross time zones and suddenly your medication schedule is off by hours. The airline meal shows up late or not at all, and when it does, it's loaded with carbs and sugar. You're stressed, you're dehydrated, and your blood sugar is doing things it never does at home. Here's what makes this scary at altitude. When your blood sugar drops too low, you can become confused, start shaking, or even pass out. And cabin crew may not recognize what's happening. They might think you're nervous, tired, or had too much to drink. That mistake costs precious minutes. The fix starts before you board. Pack glucose tablets and snacks in your personal item, never in your checked bag. Keep all your medication in your carry-on with a doctor's note. Before you leave for the airport, set phone alarms for your medication times already adjusted to your destination time zone. And when you get on the plane, tell the crew, I'm diabetic and need to keep my medication and snacks within reach throughout the flight. Can I store them near my seat? They will work with you. And yes, insulin and syringes are allowed through security with the right paperwork. Emergency number 6, severe allergic reactions. This is the one that can go from 0 to life-threatening in minutes. A food allergy or medication allergy can trigger anaphylaxis, a reaction where your throat swells, your blood pressure drops, and breathing becomes a fight. At cruising altitude, the only epinephrine available might be in the plane's emergency medical kit, and in some countries, cabin crew are not even allowed to give it to you unless a doctor happens to be on board. For seniors, this gets worse. If you take beta blockers for your heart, those medications can make epinephrine less effective when you need it most. Always carry 2 personal EpiPens. Tell the crew about your allergy before takeoff. Request your allergen-free meal at least 48 hours in advance and wipe down your tray table and armrests when you sit down. Say this at the gate, I have a severe allergy to whatever it is. Can the crew be made aware? And can you confirm my meal request? Some airlines will even make an announcement asking other passengers not to open certain products, but only if you ask. Remember at the start of this video, we mentioned one emergency that looks completely different at 35,000 feet? Here it is. Emergency number 7, silent heart attacks at altitude. This is the one that fools everyone. Passengers, crew, even the person it's happening to. When most people picture a heart attack, they imagine crushing chest pain and grabbing your left arm. That's what cabin crew are trained to look for. But seniors, especially women, frequently experience something completely different. Jaw pain, nausea, a dull ache in the back, unusual fatigue that feels like you just didn't sleep well, shortness of breath that seems like nothing more than stale cabin air. Here's what makes altitude so dangerous. The reduced oxygen in the cabin can both trigger a cardiac event and mask how serious it feels. Your body is already working harder to compensate for the lower pressure, so the early warning signs blend right into the general discomfort of flying. You brush it off. You tell yourself it's indigestion from that airport sandwich. You close your eyes and try to sleep through it, and that decision can cost everything. One viewer told us she almost dismissed her jaw pain as a toothache at 38,000 feet over the Atlantic. Her travel companion insisted they call the crew. That call saved her life. Before you fly, talk to your doctor about your personal warning signs, the ones that are specific to you, not the ones on a poster in a waiting room. Carry a current medication list and an emergency contact card in your pocket, not buried in your carry-on in the overhead bin. If something feels wrong, do not wait. Tell the crew, I think I may be having a cardiac event. I need the medical kit and assistance now. Being wrong costs you nothing. Being silent can cost you your life. Every commercial aircraft carries a defibrillator and an emergency medical kit, and crew can radio ground-based doctors in real time. Emergency number 8, stroke symptoms mistaken for jet lag. This one pairs with what we just covered because the same problem applies. The symptoms hide in plain sight. Confusion, slurred speech, facial drooping, weakness on one side of the body. These all look like someone who's exhausted, took a sleeping pill, or slept in an awkward position. They're not. Teach your travel companion one simple test before you ever board the plane. It's called FAST. Face. Ask the person to smile and check if one side droops. Arms. Ask them to raise both and see if one drifts down. Speech. Listen for slurring or strange words. Time, if any of these are present, every minute counts. Give your companion the words to say. I think my partner may be having a stroke. Can we get medical assistance and notify the captain immediately? With a stroke, the faster the plane diverts or reaches the gate, the better the outcome. That one sentence from your companion could change everything. We're almost done, but these last two catch more seniors off guard than you'd think. Emergency number 9, panic attacks and acute anxiety. Most people don't think of this as a medical emergency, but at altitude in a senior body, it absolutely can become one. A severe panic attack can mimic almost every cardiac symptom in the book. Your chest tightens, your heart races, your hands go numb, and you start breathing so fast you feel like you're suffocating. Now imagine that happening to a 68-year-old with a heart condition. The crew doesn't know if it's panic or a genuine cardiac event. And honestly, in that moment, neither do you. That confusion leads to either overreaction, which means an emergency diversion you didn't need, or underreaction, which means dismissing something real because you've convinced yourself it's just nerves. If you're prone to anxiety, talk to your doctor before your trip about a travel-specific plan. Ask whether a short-acting medication makes sense for long flights. Learn box breathing before you need it. Breathe in for 4 seconds, hold for 4, out for 4, hold for 4. And most importantly, tell your travel companion what your anxiety looks like so they can help the crew tell the difference. If it happens, say this to the flight attendant, I'm experiencing anxiety symptoms. I don't believe it's cardiac, but I'd appreciate some space and water. That one sentence gives the crew exactly what they need to help you properly. Emergency number 10, medication interactions at altitude. This is the one hiding in plain sight inside your carry-on bag. The medications you take every day at home can behave differently inside a pressurized cabin at 8,000 feet equivalent. Blood thinners may increase bruising or bleeding risk when combined with dehydration. Blood pressure pills paired with low cabin humidity can drop your pressure further than expected, leaving you dizzy or faint. Sleeping pills mixed with hours of immobility raise your deep vein thrombosis risk significantly. Even common over-the-counter sedatives can hit harder at altitude than they do on the ground. Before any flight over 3 hours, ask your pharmacist or doctor one specific question. I take these medications. Are there any altitude-related concerns I should know about? Carry a complete list of every medication with dosages, not just the names. And here's a bonus tip that ties everything together. Create an in-flight medical card. A simple laminated card or a note on your phone that lists your conditions, medications, allergies, emergency contacts, and your doctor's phone number. If you're ever unconscious or unable to speak, that card speaks for you. It takes 5 minutes to make, and it could be the most important thing in your pocket. Some airlines even let you register medical needs in your booking profile in advance. Check before you fly. So let's bring it all together. In this video, we covered 10 real medical emergencies that senior travelers face at altitude. Dehydration that hits harder because the cabin is drier than a desert. Ear barotrauma that can rupture an eardrum if you don't know the simple trick to prevent it. Blood clots that form silently in your legs and can travel to your lungs. Oxygen drops that mimic jet lag but are far more dangerous. Blood sugar crashes that crew might mistake for something else entirely. Allergic reactions that can turn fatal when the nearest hospital is 5 hours away. Silent heart attacks that look nothing like what you've been taught to expect. Stroke symptoms that hide behind exhaustion and sleeping pills. Panic attacks that mirror cardiac events so closely even doctors hesitate. And medication interactions that nobody thinks to ask about until something goes wrong. That's 10 emergencies and 10 things you can do about every single one of them before your next flight. But here's what I really want you to take away from this video. This was never about fear. This was about flying with confidence. Millions of seniors fly safely every single year, and the ones who travel the smartest aren't the ones who worry the most. They're the ones who prepare. One of our viewers, a 72-year-old grandmother, told us she used to dread flying. The anxiety kept her home for 3 years. After learning about these risks and putting a simple plan in place, she flew to Portugal last spring to meet her new granddaughter for the very first time. That trip happened because she felt ready. Not fearless, just ready. And that's all preparation is. Now, if you have a friend, a parent, a spouse, or a travel partner over 60, send them this video. Don't just save it for later. Share it with them today. It might be the most important 10 minutes you share with someone you love this year. Which of these 10 emergencies surprised you the most? And do you carry a medical card when you fly? Tell me in the comments below. I read every single one, and your story might help another traveler who's watching right now. If you're new here, we post senior travel tips every single week. Practical, honest, no fluff. Just the information that actually matters. Hit subscribe so you don't miss the next one. Safe travels, and I'll see you in the next video.